Hello everyone, this is Medical Masterclass, and today we'll discuss hypoglycemia. So this is a highly requested topic. We'll look at the contents, look at the scenario, definition, symptoms, mnemonic, causes, diagnosis, and treatment. So let's look at the scenario. A 55-year-old man with diabetes took his morning insulin but skipped breakfast. By mid-morning, he felt shaky, sweaty, and dizzy, with blurred vision and confusion. He was brought to the ER by his co-worker. How will you manage this patient? So let's look at the definition of hypoglycemia. So hypoglycemia is when the plasma glucose is less than or equal to 3 millimoles per liter. So this in a non-diabetic, alright, less than or equal to 3 millimoles per liter. But in a diabetic is when the plasma glucose is less than or equal to 4 millimoles per liter. And the reason is because diabetics, they have autonomic neuropathy, so it will take time for them to develop their symptoms. So it's better to have a higher value so that you can start management early. All right, so hypoglycemia, it's the commonest endocrine emergency. So let's look at the symptoms of hypoglycemia, and I'll give a mnemonic that I derived when I was in medical school. So we have autonomic symptoms because of activation of the autonomic nervous system, and the mnemonic is TAP HD. All right, so S for sweating, T for tremor, A for anxiety, P for palpitation, H for hunger, and D for dizziness. Then for neuroglycopenic symptoms, it's because there's inadequate glucose supply to the brain, and the mnemonic I derived is CDVSC. We have C for confusion, D for drowsiness, V for visual trouble, S for seizure, and C for coma. Let's look at the causes of hypoglycemia in diabetics. So it's usually because they are on insulin, sulfonylurea, and meglitinides, and then they have mixed meals, increased insulin activity, and drug overdose. Now to the causes of hypoglycemia in diabetics. So for this, we look at a common mnemonic, and the mnemonic is explain. All right, so we first look at the EX in the explain. So EX is for exogenous drugs. So exogenous drugs, for example, insulin. And then someone will ask, okay, so the person is a non-diabetic, so why are we mentioning insulin? The reason is because they can have access to the drugs through their diabetic relatives. All right, and then P is for pituitary insufficiency, because the pituitary gland produces ACTH, which acts on the adrenal cortex, so that cortisol is produced. Cortisol acts like glucagon to help sequester glucose into the bloodstream. So if there's deficiency in cortisol because of pituitary insufficiency, then there's risk of hypoglycemia. Liver failure, because the liver stores glucose as glycogen. All right, so there's that risk of hypoglycemia once there's liver failure. Addison's disease is primary adrenocortical insufficiency, and if there's primary adrenocortical insufficiency, there will be deficiency in cortisol production. And as we've explained, there's that risk because cortisol helps in sequestering glucose into the blood, acting like glucagon. We have insulinoma and pancreatic tumors as well. Now to the diagnosis of hypoglycemia. So you can check the RBS or the FBS. The RBS is random blood sugar, and then FBS is fasting blood sugar. Now there's a triad called the Whipple's triad that helps in confirming the diagnosis of hypoglycemia. So the triad is when you have symptoms or signs of hypoglycemia, when there's low plasma glucose, and when the symptoms resolve after you administer glucose. And so this triad helps in confirming the diagnosis of hypoglycemia. So we will look at the treatment of hypoglycemia. How do you treat hypoglycemia? So it's always better to separate your patients into whether they are conscious or unconscious, or even better still, conscious, semi-conscious, and unconscious. But I usually prefer separating patients into whether they are conscious or unconscious. So if the patient is conscious, you give the patient fast-acting carbohydrate snack. So it could be a fruit juice, or you can even give the patient Coca-Cola. I prefer giving the patient fruit juice. So you can give an orange juice, a cup of orange juice, as many as the patient can take until the symptoms resolve. So you can give like 1 or 2 depending on your clinical judgment as a clinician. Okay, and then if the patient is unconscious, then you have 2 options. You can give IV dextrose or IM glucagon. For glucagon, you can even give IV or IM glucagon. All right, so the catch here is that if the patient is having seizures, it's better to give IM glucagon, right? Because it would be difficult setting an IV line, so you can just inject it into the muscle. But if the patient is also an alcoholic or have liver problems, then the choice is IV dextrose, because the function of glucagon is to act on the liver. So once there's liver problem, go for IV dextrose. Okay, so thank you very much for listening to the video and then learning from it. We hope to bring more videos, more exciting educational content. Like, share, subscribe. Thank you.